25 years.
Yes.
I was a nurse before that.
Yes. Hello, everyone. This is Dr. Khan from Bloomfield Hills, Michigan. I have a wonderful patient of mine. She comes to us from Ohio, and so she is 4 days out from her surgery. And no worries, it happens. Let me go ahead and press over here. Yeah. So we had an issue with our stand. So now you are 67 years of age. I actually did the Facebook Live in the operating room last week.
You did.
So 4 days ago. So for those anyone who's interested, please go ahead and have a look at that so you can see the continuum. You are 4 days out. So let me go ahead and kind of go over your physical exam. On your exam on the right side, I noticed that there was some redness, some irritation, underlying inflammation. There was questionable, and again, whenever you see redness, you always ask yourself, is there an infection or not? And then you had your first set of implants from 1983.
Right.
And then tell us you had them replaced, and when was that?
In 2008.
In 2008. And at that time, your surgeon had mentioned, so this was after, that was 17 years, 25 years you had them replaced, and this was what was a ruptured implant on the right and left.
Correct.
And so that you had what were the leaky implants, and you had mentioned that, so, and then you had them both replaced in 2008. Now, I remember what you said, what was very interesting, that as soon as you got your second surgery, what did you notice?
It was probably about a year.
A year.
Within a year of having them replaced, I started noticing symptoms. My health issues started. Started with the hair thinning, the brain fog, the dry nails, the dry skin. I was having vision changes and dry eyes, and the fatigue, the shoulder and back neck pain, the chronic aches and pains that I've never had before. And they were all things that were just slowly and gradually adding to a list. They weren't severe enough that were debilitating at that point, but over 17 years of struggling with this, I saw several doctors, I saw several different specialists, I had test after test, but no one could help figure out why I was having fatigue. Then it was the autoimmune disorders that they were diagnosing me with. But nothing was helping me feel better. Nothing was being pinpoint down to any illness.
Now, what were those? Now, you're a nurse, and so you understand the medical world. The workup. You've helped a lot of patients in your careers, and you understand the human body. Like, what was the workup? What were the complaints over the years that when you went to the doctors, or what were your complaints, and what was the workup that was done?
Well, with just about every complaint I had, they would want to draw blood. I had last year alone in 12 months, I had 3 MRIs and 2 CAT scans. And they could find nothing significant that would pinpoint anything.
No, I know you yes, please.
With my blood work, then they told me I had autoimmune disorder all of a sudden. I had lupus. Then they sent me to a specialist.
A rheumatologist?
Yes, and he said, no, you don't have lupus, you have Hashimoto's. They had an endocrinologist come in, and he's like, no, you don't have Hashimoto's, you just have chronic fatigue of an unknown nature, and there's nothing we can do to help you.
Mm-hmm.
So everything was just going through, I was an experiment. It was just practicing medicine, and nobody could figure out anything to pinpoint something.
Right. Now, I remember you went to the emergency room once, and they said, let's rule out the appendix. Or is that...
Actually, I had my gallbladder out.
Gallbladder, okay.
Because they thought it could be something related to gallbladder.
Mm.
The surgeon said it was the healthiest gallbladder he ever removed, so it wasn't that.
Yeah.
So I have sought out several doctors over the last 17 years and specialists, and just gone through from one thing to the next. All along, the symptoms were getting worse to where it was just becoming debilitating. The fatigue became severe, and then it became chronic to where I couldn't function from just a day-to-day life. So it was literally robbing me of the quality of life I had.
Mm-hmm.
And I would have to force myself to do what I had to do. And if I didn't have to, I couldn't get out of bed. So all through those 17 years, things just kept getting worse and worse.
Mm-hmm. And so you had all these complaints, the endocrinologist, rheumatologist, primary, all these tests which were done yielded nothing. Now, what I find very interesting here, and again, having talked to a lot of patients, and I would say thousands of patients, this is a very, and this is all anecdotal, needs to be studied, because I've seen this enough to the point where I'm going to say this to my patients and whoever is listening. I have seen this where the patient had a set of implants, let's say saline implants or silicone implants, and they really, after 10, 15 years, said, okay, let me go ahead and go size up, or they needed to get it replaced. Then when they went and got their second surgery, that's when the symptoms went haywire through the roof. And all of a sudden, their emergency room trips, complaints, the fatigue, brain fog, all those symptoms that you see the patients complain of on the Facebook lab, and all the tests yield nothing.
Correct.
And then the doctors say at the end, when they really cannot have anything else to say, fibromyalgia,
Yes.
the fatigue, and then they mentioned that anxiety and depression, anxiety. And this is where, as you will see, let's go ahead and look at this mentor ad. And I'm going to quote unquote, it says, quote, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery, close quotes. So this is where, in your case, what led you to the surgery in 2008?
In 2008, I had them replaced because the MRI showed that they were leaking.
Oh, got it. Okay, so that was the indication, and that's certainly very reasonable.
Yes.
Now, let me just go ahead and mention, the answers are right here if you ask me. This is like kind of the answer book. This is the mentor advertisement. This is the journal that we read. And look, they're advertising for the plastic surgeons, the moderate high profile, the mentor memory gel boost, breast implant portfolio. Connect with a representative about full lineup of mentor memory gel boost. Now in the fine print, I'm going to read, quote, MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture, close quotes. Silent rupture means that the patient's doing well, the exam is within normal limits, and all of a sudden the MRI is done, it shows that there's a rupture. And the patient has no true complaints, has a silent, meaning the exam is unremarkable. Mar, if you can turn the camera a little bit this way, just so that we can get, okay, wonderful. All right, now the other thing that I want to mention here is, this is the part where you have a lot of plastic surgeons say, well, breast implant illness doesn't exist. And as you will see, and I'm going to go ahead and read, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others, close quote. Now look, you already mentioned these symptoms. Yeah, I'm going to continue on. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. So over here we see, number one, BI exists not in all, but in the selected patients, as the patients have confusion, muscle aches, joint pain. This is the fibromyalgia diagnosis, very common, and anxiety, depression, confusion. So this is where the doctors do not know, and then they label the patient as stressed out, social media phenomenon, and you're as normal as I and as any other patient. But you have these complaints, and this is the underlying root cause of the problems. They're the doctors, and specifically the plastic surgeons, are not listening to the patients, and that is the root cause of the problem, because it is the same set of symptoms that we saw in the 90s, early 90s, that led to the ban.
Correct.
And this is that silicone reactivity, toxicity that we hear about and see. And the whole goal of the surgery is to remove the entire implant. And in your case, given the history of the rupture, anything and everything inflamed around that capsule such that if there is a question of removal of that inflamed tissue, it is removed. If my sixth sense says it needs to be removed, it's removed. So I'm not second guessing myself and I'm removing it. Because remember, there's an area that is inflamed, clearly that's removed, but the area around that's even questionable subjectively by my experience, I remove it because I don't want to leave that potentially behind, and that is in itself the underlying culprit. Now, not all the patients will have the capsule that is, quote, problematic. Now, today, I just saw one of my patient's path reports came back, and this is the final pathology report, and I have the patient's name crossed off, and I'm gonna read quote unquote, and we're gonna look at this together, right breast implant capsule. So the whole world says, all the plastic surgeons, whatnot else, why remove the capsule? This is the reason why. Not in all patients, but this is where we do not know going into the case, which is gonna be what, because grossly by looking at it, by my eyes or my the amplification from my loops, the 2.5 times, that we're going to be able to pick this up. And this is where the pathologist is looking at it under the microscope. So over here, Dr. Mazzara, who's a board certified pathologist, is reading my patient's capsules. This is not yours, by the way. It says right breast implant capsule, fibrous capsule with foreign body giant cell reaction to rare droplets consistent with extravasated silicone. So the silicone leached out and deposited, embedded within the capsule. So if you remove the implant, you have removed the burden, but that capsular tissue has in it the added burden still that needs to be removed. So you will see many patients where the capsule is left behind, the patients are not benefiting, and only when that capsular tissue is completely removed do the patients recover. And this is the homework that you had done, and this is what the homework that everyone needs to do, because it's not only about the implant capsule, in your case, that inflamed tissue around, that needs to all go, and it needs to be done very respectfully, very sincerely, religiously, honestly, with full due respect to the burden. Now, if a surgeon is denying the fact that breast implant illness exists, the first thing I'm going to say is, guess what? I just read off of the journal here and their advertisement that it absolutely does exist. So automatically breast implant illness exists, and there should be an ICD-10 code, so the patients should and must get reimbursed for their problems that these implants are causing. In your case, I checked below the muscle, as I showed you in the video, that there was virgin territory, there was no implant below, there was no muscle cut. And I actually lifted the muscle up to show that there was pristine ribs. That I needed to do because maybe the first implant was below and the second one was above. The other thing is I removed and cleared out all the area around such that only good, healthy, viable tissue remains behind, and the bad tissue was removed. Yeah. Now, let me ask you this. How was your anesthesia experience?
From what I understand, it was great.
Yeah. Do you remember anything?
I don't remember a thing.
And if you remember, you were a little bit embarrassed. You said you heard yourself snoring.
I did.
Yes. So it is perfectly fine. We all snore. Now, the second thing is, how was your pain post-op?
I am 4 days post-op, and I do not have any, nor have I had any pain at all.
What did you take for pain control?
I took a Tylenol one time.
Yeah, and then you did get the Explant as well.
I did.
Yes.
And I would recommend that highly. It's just a comfort and a peace of mind. So the Expert, I think, was wonderful.
Right. I feel in my mind that...
I mean, this is major surgery.
Right, this is. And you see the incisions. If you go on Facebook and YouTube, specifically go to YouTube Shorts, you will see we have uploaded videos from the operating room showing the entire chest. And we're going to basically produce a lot of these videos so you can see firsthand exactly what remains in the chest, which is only good, healthy, viable tissue, and what you see on the table, the cutting open of the capsule. So if you put together both of these videos, you will have no doubt that your surgeon took it all out, because that's the ultimate proof. Like when you're looking at the videos yourself, you have that 100% satisfaction and confidence that all of that capsule was removed. Remember, this is all about the capsule. Now, let me ask you this. When you came for this surgery, how sure were you that you were going to take it, like this was gonna benefit you? Because now in the last 96 hours since your surgery, now let me ask you this, have you noticed anything different?
I have been actually just resting for the last 4 days, but I don't feel the fatigue like I had in that chronic sense. I don't feel the puffiness and the dry eyes like I did, so I do feel a little better.
See, it's too early, and I will say this,
But
that
I
we
am
will.
just resting right
Yeah,
now.
yeah, you're in the peri-op phase, and I'll tell you, one of my patients, I said, well, it's too early, Now, I want to do a Facebook Live with you because I know you're not coming back again from Ohio. And so, unless you happen to be in town, because we would love to hear from you in the next 6 months, a year and a half out. How sure were you that you were going to benefit or you are going to benefit from the surgery?
100% sure because of the journey of the research that I did.
What research
So,
did you do?
starting the 1st of January, which was the first time I had ever heard BII, didn't even know that anything existed with breast implant illness. So 1st of January to the end of February was the first time I even heard of this. I started doing research. I started going to the hospital libraries, pulling up medical journals and doing research on my own to find out. I came across one of your podcasts and listened to and watched a lot of your podcasts and your videos on your surgeries to learn about the end block and how important that was to get the capsule out in one piece.
Mhm.
So I then started calling plastic surgeons in my area.
Mhm.
I interviewed 7 plastic surgeons, and none of them would guarantee me that they could take the capsule out in one piece, nor did they ever say it was even important to do that. Even if I insisted that's what I wanted, they wouldn't comply with that. None of the ones that I interviewed with believe in BII.
Mhm.
So they were not committed to my health, to making sure that they did what was best for me. So after watching your videos and your podcast and listening to you explain this, doing my research, talking to several different surgeons, that every surgeon can take them out, but they're not going to take them out with your health in mind, doing it the right way. So at this point is when I just knew Dr. Khan had to be the only person that I could at peace feel 100% confident and sure of, that I wouldn't have to worry about anything else again.
Now, if you look at your video,
Mhm.
when I did the Facebook Live, you will see that white paint that crystallized.
Yes.
That you have the confidence going in because you knew I was going to reproduce the same results that you have seen many times over.
Yes.
And
Yes.
this is where, yes, you had the implants, and this is the same manner that every patient in the world should get these implants removed so that you're not second guessing your
Correct.
surgeon. Very important. And this is the take home message. In the last year, I have had 3 patients with CD30 positive. Now, I did not have to go back and remove any more capsule because I already did it right the first time. And this is the take home message from your words of wisdom. Do it right, do it once, do it with confidence, do your research, do your homework. Tell your surgeon, before I came in here, I said, I'm going to examine you. I'm going to show you the pictures and the videos so you can see the other half, the chest wall, showing complete removal, so that as you drive back home to Ohio, you have that utmost confidence, you have the smile, you have the peace of mind. All of that bad tissue was removed, and all of it was tested, and it's still in the testing phase. Anytime someone gets the surgery, I send the capsules off to pathology, so the MD doctor is looking at it, making sure it's not cancer, that very rare lymphoma, anything bad like BIA-SCC, which is the breast implant associated squamous cell cancer, anything related. CD30 analysis is done on all my patients. And number 2, the lab workup is the microbiology, aerobic, anaerobic, and fungal cultures, so that we know. Just within the last week, I've had 2 patients, one from New York and the other one all the way from Washington State, the other half of the US. Both of them had Candida positive, and I sent the patients respectively to infectious disease. And the infectious disease doctor that I talked to from New York, he called me up and I said, I have removed everything. There is nothing remaining. It's all a clean job. And he can see the pictures and the videos. The patient already has the pictures and videos. and she's peace of mind that there was nothing bad remaining behind and nothing spilled into the chest. In your
Right.
case, because there was fluid. In the past, I have seen that white paint come back as bacteria.
Mhm.
And this is where going in, could it be inflammation? Could it be bacteria? Could it be God knows what? We're gonna rule all of that out. So you're gonna have the peace of mind that all of it was removed and all of it was tested.
Yes.
Now,
A lot of the surgeons would tell me they would make a small incision, they would cut through the capsule and pull the implant out and leave the capsule in. The capsule is what was exposing me to all that inflammation, and inflammation causes all the or autoimmune disorders. So without having that removed in one piece, I would never have had the peace of mind that I am healthy and it's not the implants making me sick.
Right.
So it was really important to me to make sure that you did this surgery, trusting you 100% sincerely that you were going to do the end block in one piece and not let anything else be exposed.
yes, now, so this morning I did a little bit of a research. To date, there are thousands, I use the word thousands of surgeons out there who are doing end blocks and total capsules. And as you will see, the thousands, majority of them are still doing implants. If someone is doing an augmentation and putting in implants, how can you, in your goodness of heart, be doing an explant sincerely? Now, this is a big question mark. Either you believe in one or the other, because you cannot, quote, if you will, do a total capsulectomy end block. And the word end block, in a sense, is the medical term for cancer, but end block essentially means that the entire capsule, implant, inflamed tissue is removed, such that if there is any badness on the inside, it doesn't spill out. So there's no other medical terminology that kind of describes it other than this. And so we now extend it from the oncologic literature to explant, such that 100% total capsulectomy without a break in the skin is done, such that none of that internal badness leaks out. Today is Monday, so I've had a very busy clinic. I just want to mention 2 patients before you. One patient, 75 years of age, she came in with bad rheumatoid arthritis. Literally, her fingers were very much affected. You could visualize it even before I walked in, the way she was holding the papers. And lo and behold, she went to another top-notch surgeon right here in the area. And believe it or not, she was advised that she was going to get her implants exchanged, and this is the best thing for her. And I will tell you, just the fact that she has an autoimmune rheumatoid arthritis, that in itself is a reason to not replacing or putting in implants. The surgeon then said, well, if you want me to remove the capsule, I will remove the capsule. And I'll tell you, he said to the patient, sometimes the capsule is so thin, I may not be able to get it all. I will tell you, if that was your surgeon, he would have had that capsule or tissue left behind, unfortunately, and that would be an incomplete surgery. And so the surgeons, if they're not sold from their heart, I always say one free soldier is better than 10 hired ones. In this case, one free surgeon is better than 100 hired ones, and meaning insurance, or they have other motives, or they don't believe in BIs sincerely, or they don't have a track record. You have to be very careful. Don't go after the list. On that list, I saw 135 surgeons who are supposedly explanting, but they're all pretty much, most of them, well over 90, they're putting in implants. So now they lose their credibility, because what do? Do you believe that the earth is round, or do you believe that the earth is flat? Because you have to believe one, but not the both. And you cannot basically be politically correct by saying, well, I'm a organic surgeon, and guess I will still put in implants, and I put, fillers, and I do all of that. No, you cannot say that. You have to choose one or the other, and you have to listen to the patients. So this patient, she knew better, but she said what was catching is the insurance was going to cover all of it all, and her surgery was going to be very short lived. And the other thing is, the same patient with rheumatoid arthritis, she had an MRI done that showed that there was fluid around the implant, and she had what is a BI-RADS 4, which is a suspicion for potential malignancy. Anytime you have fluid around the implant, the surgeon has to be thinking BIALCL, tilprovenal otherwise, which is underreported. And they were offering her a replacement. And I will tell you that is absolutely wrong because of the RA, rheumatoid arthritis. That is absolutely wrong because of her age alone. You can only imagine she had 600 cc implants right and left, and you can imagine how her chest and neck and back is being taxed by her current set of implants. And number three, that she has this potential fluid in itself is a reason to not replace, because you have to send that fluid off. You have, because God forbid she has BILCL, you just put another set in. And so I use the word screw up, mismanagement, malpractice, wrong, bad medicine by the other plastic surgeon who's a reputable part. And I will tell you ethically, it was the wrong answer for the patient. And the 75-year-old was smarter than that, because she came to me because she knew. As soon as I walked in, she said, your voice is so familiar. It goes through my mind as I sleep because I've seen so many of your videos. Another patient right in this room came in. Believe it or not, she had her implants from 15 years ago, and she had a chest x-ray done. And on that chest x-ray, they saw that her right breast implant was indeed very much ruptured. And the chest x-ray radiologist said, go ahead and get a MRI. And lo and behold, she did get an MRI, which clearly stated that she had what is grade 4. She had a rupture on the right side. And on my exam, she had a grade 4 capsular contracture. So this nice couple, they drove from Jackson, a couple hours away, no HIPAA violation here. And she stopped at a major medical center and a major plastic surgeon who said, we're going to remove your current set of implants and we're going to put another set in. And to that, her husband jumped up and said, absolutely not. Because we've already gone through this misery of that rupture, and we don't want to have to live with it another 10, 15 years later. And when I gave her the answer, so it was a big contrast between what I was offering her in what the other surgeon, and again, she knew better. So I say to you, in these two cases, the patients are smarter.
We're doing research.
Yeah. And you have a PhD in this. That's, if I give you a marker and I give you a board, you can give a lecture on breast implants. And this
I can now.
Yes. and you know, and you have a nice smile. This is a piece of, and this is what the patients are doing. The patients are overriding their local plastic surgeons and taking this matter in their own hand and being the leaders in the world, because no one is listening to them. And you knew better after those 7 plastic surgeons, because it doesn't take much to put the one and one together and to say that, this is not worth the risk.
And I do have to say, if it wasn't for watching your videos first, I would not have known the right questions to ask when I was interviewing those surgeons. But, and I know I mentioned this to you before, I have great respect for you and admire you because you have a conviction that you believe in BII. You believe with all the symptoms and all the patients you've talked to that there is something here with these implants that are making women sick. But the conviction that you will not put them in, that says so highly about you. I think I told you last Wednesday or Thursday that the Bible says a double-minded man is unstable in all their ways. And I am thankful to say that you are not that double-minded man. You have a conviction and you stand on that.
That was very strong.
To not put them in, you have to have a conviction and not to waver just for money.
Yes. I will tell you, I will confess that the hardest part was when you finish your 10 years of training and your medical school. This is after medical school. So you have after medical school, which was 5 years for me, and 1 year of research that I did in Boston at the Beth Israel Deaconess Medical Center. I did 5 years of general surgery. That was like almost 100 hours to 120 hours a week, because remember, you're staying after, you're studying at home, and believe it or not, I always went over hours. And then you have 2 years of burns training and then 3 years of plastic. So that 10 years after medical school. And this is where I was involved with a lot of gunshot wounds to the chest in my general surgery training, to breast cancer patients, cancers of the chest, thoracic surgery. The research that I did in Boston was a cardiothoracic research lab. And I followed a lot of cardiothoracic surgeons. And then when I came out of my training, I was as poor can get, you know? And this was the time for me to put in the implants, and I said, I am not going to do something that I do not believe in.
Oh,
It
God
is the,
bless you.
yeah, and one of the one of the patients that I took care of a couple of years ago, she said she did her research, and she said, and very humbly, and thank God, God put this in my mind, she said that you're the only surgeon who is not purposefully, deliberately put in implants from day one, and I only put one in order to get board certified. And I told myself, having seen a lot of patients over the years, and being a biochemist, and having seen the band, and having seen the patients come out with ruptured implants, look what you know now.
Oh,
And
yes.
imagine you operated on all these patients, would you have the nerve to put in an implant in a patient? And that is, requires a lot of guts,
It
right?
does.
Especially, you know, when the patients say that, two things, almost all of them, they wish they had never gotten implants, and they wished that they had removed them sooner so that you would have gotten your life back.